retirement, you'll face many unexpected and unpredictable events, including significant healthcare needs. Joining me to discuss that risk and what steps you can take to manage the risk of significant healthcare needs is Cindy Levering. Cindy is a co-author of Managing Post-Retirement Risk, which was recently published by the Society of Actuaries. Cindy, let's start with you giving us a description of this risk and then how to manage it.
Sure. Well, unexpected healthcare costs, as Bob said, are a major concern, not only in general, but in retirement in particular. Employers are continuing to cut back on their post-retirement medical benefits, and that's something that's been going on for a while now. So there's very few that even provide any kind of subsidy for that. Low-income retirees might spend a significant portion of their resources on healthcare. Although Medicaid does provide some assistance to them, so that is another option that they have. Medicare doesn't cover everything. There are some deductibles and copays, and it also doesn't cover dental, vision, hearing, and most long-term care. And I think a lot of people don't really focus on all of those things. Prescription drugs are covered under Medicare Part D, but that's something you have to elect and pay for and do open enrollment on every year. Medicare doesn't cover some out-of-country care if you're going to be traveling a lot in retirement, and care provided by medical professionals who don't contract with Medicare. So a lot of doctors are not seeing Medicare patients possibly because they don't want to deal with all of the bureaucracy and the reimbursements. Uncertainty over the future of healthcare regulation and financing, in particular with Medicare, may be hampering people's current retirement planning. And out-of-pocket expenses may increase in the future if Medicare reduces what it covers and more doctors choose not to contract with Medicare. In terms of managing the risks, obviously Medicare is the primary source of coverage for most post-65 retirees. It's also important to explore the availability of public support. There might be federal, state, or local programs that can be of assistance to retirees. So there's a lot of things to think about when you're looking at healthcare coverage. Health savings accounts, which can be useful. A lot of people don't really understand them, but that's a tax-advantaged way to help pay for medical costs in retirement. Making good lifestyle choices, keeping yourself healthy, making healthy choices, and living a healthy lifestyle is important. Again, for early retirees, as I mentioned, there might be a gap period, but the Affordable Care Act offers some options within the marketplace for that. So they may be limited, but it's worth exploring all of those opportunities. And one thing that, is probably not going on very much now that people are thinking about is maybe obtaining care out of the country for things like dental or elective surgeries and things like that. Obviously, there are risks, and you have to really look at that carefully. But that's another possibility that might save some money in the short term.
Cindy, thanks ever so much for walking us through how to manage the risk of unforeseen healthcare needs.
You're welcome.